I'm Dr. Lenora Williams. I am an obstetrician, gynecologist. I've been here in Ellington for the last 22 years. I did my undergraduate training at Wesleyan University in Middletown. I majored in biology and also received honors in music, which is one of my passions. I did a master's in liberal studies, also at Wesleyan, and then went on to do my medical school training at the University of Connecticut School of Medicine. I also did my residency there at the University of Connecticut School of Medicine OBGYN residency program. OBGYN is important. I chose that because I have the opportunity to work with women. I think it's very important to be in a position to not only inspire and encourage, but to empower women. Women, they are in a unique position in the family unit with respect to family health care. So while I provide health care for the woman, I also indirectly provide insight and input to the health care of that family unit as well. In OBGYN, I am sometimes, by default, a role model, particularly to minority women and other women of color, which is important. I find that women will come far and wide to be taken care of by someone who looks like them. I think the patient-physician relationship has to be a collaborative relationship. The patient is an active participant and partner in her health care. I try and see the person within the patient so that her care is collaborative, we work together, and it is individualized. I do not practice one-size-fits-all medicine, and I think patients appreciate the fact that I listen and formulate a healthcare plan with their input. Despite all of the challenges that our healthcare system throws at us, I can say I still care. ECHN has invested a considerable amount of time and effort to providing the obstetrician gynecologist with state-of-the-art equipment to work with and state-of-the-art facilities for obstetric patients as well. We still maintain a maternity care center clinic that helps to serve underserved and uninsured women in the Tri-Town area, which is, I believe, extremely important, not only to those women, but to the health of the babies that they carry and will be delivering. ECHN has invested in equipment that will help serve our patients better. For example, minimally invasive surgeries, both laparoscopically, hysteroscopically, and most recently, robotically. I currently am involved in training on using the Da Vinci robot system and hope to be very soon able to offer that type of minimally invasive surgery for my patients. I like to think that I have a great sense of humor, that I'm witty, and I'll be the first one to make a joke. Usually it's about myself. I have a great passion and love for music. I have in the past done concerts for the community and have done benefit concerts for such places as the Women's Center for Wellness, which I think again is one of the jewels in ECHN's crown in terms of providing specialty care for women. I also am an avid tennis player, not to be confused with good tennis player, but I love to play. I love the outdoors. I love biking, hiking. I love kayaking on the aquamarine waters, particularly in Aruba, but it doesn't have to be there. I love working with young people, again in the role of a role model, encouraging them and also empowering them so that they set their goals high and try to achieve those. I am the vice president of the Farmington Valley chapter of the Links, which is an African American women's service organization. And we do quite a number of things within the Hartford community to help serve underserved folks of color in our community.